Hi there, my name is Hannah Rust, and I am a Band 6 rotational speech and language therapist, and I am proud to share the work that speech and language therapy at UHD have been doing, focusing on education and training needs as outlined by our workforce. I was given the opportunity to take on a 6-month learning facilitator role with the main aim of supporting our 5 newly qualified Band 5s in gaining dysphagia competence. I went on the A3 training, which helped me to frame my project as a dysphagia learning facilitator by looking in depth at the problem we faced in speech and language therapy, which related to having a large percentage of the team requiring supervision when working with patients with dysphagia. As this was my first experience with project and service improvement work, the A3 helped direct me to include all of the relevant information and to understand exactly why the role as a learning facilitator was required. For example, not just forming a broad vision, but diving into the current state of the problem and what the contributors or causes of the problem are. In speech therapy, this came down to not having enough dysphagia competent staff to work independently, to ensure that our patients are seen quicker, to reduce the time spent nil by mouth, and in turn reduce length of stay, malnutrition and mortality, whilst increasing quality of life for our patients. Once these factors became clear, the problem statement was refined and we got to work on it. From little background research into comparing confidence levels and time spent on dysphagia-related supervision, I was able to present a clear action plan going forward. All therapists that received supervision as per the project plan were successful in achieving their dysphagia competence within 6 months. In addition to this, they are now contributing to working on the weekend rota and have achieved Band 6 positions within the Trust. There were other positive outcomes associated with the project. For example, Band 5's confidence levels when working with people with dysphagia increased from an average of 50 to 80%. The confidence of supervisors encouraging Band 5s to work independently with dysphagia caseloads increased from 80 to 90%. Time spent supervising Band 5s with dysphagia caseloads decreased from 3 to 4 hours per day before the project to 1 to 2 hours per day following the project. Band 5s that received this supervision achieved their competencies in an average of 50% less time than previous newly qualified therapists at this trust and others across the country. A set of recommendations and opportunities were then presented, which help therapy leads to clearly see positive change using data that was collected, and how the project helped to solve our problem of needing to provide efficient but high-quality dysphagia training. The A3 itself consists of high levels of detail, demonstrating that you have taken a logical approach to solving your problem. However, it is also supposed to be visual and concise. This helps your target audience to keep interested and get buy-in for what you are recommending following your outcomes. The options that we presented to the therapy leads at Quality Forum using the A3 were compelling enough that it was agreed we should not just do nothing and move on. So, the A3 gave us the data and outcome measures required to advocate for further services, such as a specialist dysphagia learning facilitator for higher level skills in instrumental assessment and tracheostomy care. In addition to this, I have spent some time working on the creation of some resources to ensure the sustainability of the project. This includes annotated dysphagia competency frameworks, how-to guides, and tips for successful dysphagia-related clinical supervision that can be replicated in the future. I am happy to take questions about my A3 to my email hannah.rust@uhd.nhs.uk. Thank you.